Hello, my name is Dr. Bharati Bhardwaja. I am the rheumatology clinical pharmacist at Kaiser Permanente, Colorado, and I want to thank you for joining today's Journal Club webinar presenting the results from the randomized TOGETHER-PsA clinical trial. The TOGETHER-PsA trial is the first study to evaluate whether adding a GLP-GIP receptor agonist, tirzepatide, to a biologic, ixekizumab, improves outcomes in patients with active psoriatic arthritis and overweight or obese. This study represents a shift toward both systemic inflammation and metabolic drivers of psoriatic arthritis simultaneously. It's a 52-week phase 3 randomized multi-center open label trial. And the study concluded earlier this year in 2026, and I'll be presenting study outcomes data at week 36. Eligible participants were adults aged 18 years of age or older with a diagnosis of active psoriatic arthritis for a minimum of 6 months. And active psoriatic arthritis was defined by at least 3 or more tender joints and at least 3 or more swollen joints. Patients were also overweight with at least one weight-related comorbidity, including hypertension, dyslipidemia, obstructive sleep apnea, CVD, type 2 diabetes, or obesity. Background standard of care was also permitted, and these can be found in more detail in the supplemental material table S3, and included conventional DMARDs if the following were met prior to visit 2. So essentially creating a population that's representative of the complex patients we commonly see in clinical practice. Key exclusion criteria included failure of more than 3 different classes of advanced therapies for psoriatic arthritis and are listed below. Prior use of ixekizumab or tirzepatide, and also prior failure or intolerance of an IL-17 inhibitor or GLP-1 receptor agonist. Again, further details of eligibility criteria, including prior and concomitant therapies, can be found in the supplemental tables S1 through S3. The primary efficacy outcome for this study was the simultaneous achievement of ACR 50 and at least 10% weight reduction at week 36. Secondary outcomes were also assessed for enthesitis, dermatologic outcomes, as well as metabolic outcomes. So looking at the treatment period, again over the 36 weeks, for the primary endpoint, at week 0, patients were randomized 1-to-1 to receive either ixekizumab or combination therapy with ixekizumab and tirzepatide. Ixekizumab dosing was administered subcutaneously using approved U.S. prescribing information dosing for both load and maintenance for both psoriatic arthritis indication, as well as combination of psoriatic arthritis and psoriasis. Tirzepatide dosing was also subcutaneous and was administered at 2.5 milligrams once weekly for 4 weeks initially, with dose escalation by 2.5 milligrams every 4 weeks to achieve the maximum tolerated dose. A quick review of the baseline demographics for the study. Overall, majority of patients were female with a mean age of 55 years, a mean BMI of 37.6, and the mean duration of psoriatic arthritis diagnosis was about 8.9 years. 71.6% of patients had coexistent psoriasis, and lastly, 63.1% of patients were experienced with advanced therapies. The results of the primary outcome are illustrated in this chart here. The ACR 50 and greater than or equal to 10% weight reduction was statistically significant at week 36, with a 31.7% response in the ixekizumab and tirzepatide group, compared to 0.8% in the ixekizumab group. So this demonstrates that the combination therapy was more effective at achieving meaningful disease control while producing clinically significant weight loss. Some highlighted secondary outcomes, results favoring combination therapy are included in this table here. So we have a statistically significant difference in the change from baseline for disease activity index for psoriatic arthritis, as well as an improved absolute PASI scores when looking at a change from baseline. And for metabolic parameters, highlighting here body weight and hemoglobin A1C, in which we see a statistically significant percent change in body weight and percent change in A1C. For safety outcomes, the safety profile was generally consistent with the known adverse events for each medication. Gastrointestinal adverse events, including nausea, vomiting, diarrhea, were more common with tirzepatide. There were no new safety signals that were identified, and overall tolerability was considered acceptable. So, in summary, we know that there is a higher risk of cardiometabolic comorbidities in psoriatic arthritis. Obesity is an active contributor to psoriatic arthritis disease activity and not simply a comorbidity. The TOGETHER-PsA trial provides encouraging evidence that patients with psoriatic arthritis who are also overweight or obese may achieve better outcomes when treatment addresses both immune-mediated inflammation and metabolic health. So while ixekizumab remains an advanced therapeutic option for controlling psoriatic arthritis, adding tirzepatide in appropriate patients may improve disease control, promote meaningful weight loss, and enhance quality of life. So hopefully with future studies, we'll continue to learn more about autoimmune markers and how these directly are impacted by incretin or GLP-1 receptor agonists. So this concludes the review of the TOGETHER-PsA trial. Thank you for listening, and for more educational content, feel free to visit online at RhAPP Content Room, or you can access it through the RhAPP ACE app. Thank you.